Greetings, sailors, Marines, and families. I'm Rear Admiral Bruce Gillingham. As Surgeon General for our Navy and Marine Corps team, I want to take a few moments to talk with you about the novel or new coronavirus. This is the virus that was first detected in Wuhan, China, and has been in the news recently. Our Department of Defense and Navy leadership have been actively engaged on this issue to help protect you and your family. The guidance and procedures we are following are closely coordinated with our interagency partners, especially the Centers for Disease Control and Prevention, or CDC. This ensures accurate and timely information is available, and all appropriate measures are taken to prevent the potential spread of the virus. Based on the information we have at this time, the overall threat of contracting the novel coronavirus outside of China is low. Colds and influenza are far more common. Navy and Marine Corps personnel and their families who have recently traveled to China should be aware of respiratory symptoms such as fever, cough, sore throat, or difficulty breathing. Should a service member or family member who has recently traveled to China experience any of these symptoms, they should call ahead to their medical provider to receive additional instructions for clinical care. There is currently no vaccine to prevent the novel coronavirus. The best way to prevent infection is to avoid exposure to this virus. To help prevent the spread of viruses, the CDC recommends the following: avoiding close contact with people who are sick, avoiding touching your eyes, nose, and mouth with unwashed hands, washing your hands often with soap and water for at least 20 seconds using an alcohol-based hand sanitizer. The readiness of our forces and families requires ensuring we are all in the best health to perform our duties and take care of our families. If you do become ill, take the right actions to keep others from getting sick. When you are sick, stay home or follow your local sick call procedures. Cover your cough or sneeze with a tissue and then discard the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. And know this: my team is working on this situation, is in frequent contact with every Navy and Marine Corps medical department and facility around the world. Every healthcare provider in the Navy and Marine Corps is being provided the latest information and treatment recommendations. If we do what is necessary to protect ourselves and our families, we can avoid illness, stay healthy, and complete our missions. Be smart about your travel precautions, and what you can do to protect yourself and your family. Remember this: Navy medicine is here for you. If you need help or have additional questions, please contact your local medical representative. The CDC website has the latest and most up-to-date information. The Navy and Marine Corps Public Health Center website also has information on the novel coronavirus. Thank you for your attention to this important health information. Just as you defend our country 24/7, Navy medicine will continue to work around the clock to protect you and your families. We have the Medical Watch.
Been out here running every morning, 72 days straight, man. Just because y'all don't see me on the YouTube every morning don't mean I ain't out here, man. I'm out here getting it every single morning faithfully. I had to replace some bad habits with some good habits. Compact inches, man. The little small things you do every day on a day in and day out basis are going to change the reality around you. So if you want your reality to change around you, you got to put some different habits, man. Different habits. Replace those bad habits with good habits. And you're going to see a change, man. Trust me, my friend. Trust me. Y'all sitting around worried about coronavirus. Come on, man. Don't you know they do that so we go to the grocery store and spend our money and buy everything up? They had the swine flu. They had the flu. They had Ebola. They had SARS. Man, it's something. It's always something for you to worry about. It's always something for you to put you in fear. They want us to live in fear, man. You got to get rid of that fear. You can't walk around with fear, worry, or doubt. Those are negative emotions. Those are low frequency emotions, man. You need to be vibrating at a high frequency out here. That's what's going to manifest your goals and be successful. You know what I'm talking about? That's the only way we're going to win out here, man. That's how we're going to prosper. Have a prosperous life. Pray to God, man. Build your relationship with God. And remember, if you're sitting on your knees praying and asking God for, but you ain't being obedient and you wondering why your prayers ain't getting answered, that's why, right? You got to make some sacrifices. You got to give up some things. You got to show some discipline in your life. And that's when your prayers will be answered. I had to give up some things. I like sleeping in. To get up early, do this run every day to show my discipline, show my obedience. I had to get on my knees every morning, pray. I had to read every morning, show my obedience. That's my daily disciplines I'm supposed to do every morning. So now when I get on my knees and ask God to answer my prayers, He answers all my prayers, man. So if you wonder why your prayers ain't getting answered, maybe you should take a look at your life and your daily actions and your habits and things you do. Stop sitting around gossiping about people, man. Successful people talk about ideas and talking about people. Get off Facebook, man. Doing, you know what I'm saying? Just checking around Facebook. This is your life. Today is a new day. You were born today. Not everybody today. Not everybody woke up today. You woke up today. You got 24 hours. What you do? Come on, man. Stop making excuses for yourself. You know what I'm saying? Y'all out here making excuses. You see dark cloud. I could have been like, oh, I think it's finna rain. I ain't gonna go run today. It's cold out here. No, man, I ain't making no excuses. I gotta get up to my program, man. It's 2020, March 12th. Been out here for 72 days every morning. Finna get back on my grind, man. Y'all need some motivation in your life? Go to motivationalbum.com. Get the new book I wrote. Get the new motivation album. Give you something to listen to while you're on your run. I'm finna put these headphones on, jam this motivation album damn self. Y'all stay up, stay real, man. Ain't nothing but love.
My name is Diana Chan. I'm the Chief Executive Officer of the Media Group and communicator based in Singapore. We are here today to discuss a holding that of a novel coronavirus, the Wuhan virus. It is named because it first appeared in December in a sea market in the largest city in Hebei province in central China, with a population of 11 million. So it's been compared to SARS, which caused the deaths of nearly 650 people across mainland China. To date, we have already had more than 560 cases and 17 deaths. Just today, a few hours ago, Singapore, where I'm from, announced its first confirmed case. We have 3 experts with us to help us put in context the holding situation. On the left, we have Dr. Jeremy Farrar, Director of Wellcome Trust in UK. Dr. Richard Hatchett, Chief Executive Officer of CEPI, which stands for Coalition for Epidemic Preparedness and Innovations. And finally, we have Mr. Stefan Bansel, Chief Executive Officer of Moderna, a US-based biotech company. Start with understand what we are dealing with right now. And for that, Jeremy and Richard, kindly tell us what we know now of the virus. What do we expect to happen?
Yeah, thanks very much, and thanks to everybody for joining. Just back a bit, so you can appreciate what I'm going to say. I'm an infectious disease person by background, worked very, very closely with China during the break, and spent 20 years living in Vietnam, but worked closely with countries in the region. So that's where I come from. This infection, which has come about from the beginning of December, started in an animal market in Wuhan, and probably was a virus that was infecting animals, most likely, I think, bats in that market, and it crossed the spectrum and it came into infecting humans working on market. Subsequently, through the month of December and then days of that infection spread from animal to human, but then importantly from human to human. And now we are end of January, we are about 6 weeks into this outbreak. This virus can clearly spread between humans. It's spread by the respiratory tract. That means somebody with symptoms would cough, throat, and would somebody else by coughing or sneezing in the same way that influenza is spread around people. It's not SARS. The virus is in a similar family to SARS, but this is different. And the difference is probably it's easier to pass between human beings. SARS was quite difficult to pass between humans, and for most when they had symptoms, and therefore it was relatively to bring the epidemic under control. When the outbreak spreads humans, it's actually very difficult to bring the epidemic under control. And there's a very difference between SARS and what we believe we know about this virus so far. The virus is now course across China. Many cities in China have reported cases. Singapore reported a case, and other countries have. We can expect that there will be many more cases in China, and that there will be many more cases in other parts of the world. I would stress also in comparison with SARS that infection will probably mean in the long term that it will cause less, fewer people will die, 10% of people die from SARS. I suspect the mortality rate with the infection will be lower than that. It spreads to a wider population. So what we have is a broad infection, probably less marked number of people, percentage of people die. That in some ways, from a public health perspective, it's harder to deal with. We can't predict the future, and we're living in a period of great uncertainty at the moment because we don't have all the information we need. China recognized this, it shared the information very quickly. That was different to SARS, and therefore it alerted the world this outbreak happened. That would not happen maybe 20 years ago, and we should congratulate China in the way they open sharing of the information. The future, the world has got to think about how we can prepare now by developing vaccines. Richard will talk about that, drugs that may counter this infection, to what we can do at a public health and societal level to try and prevent the epidemic spreading further than it might otherwise do.
Thank you, Jeremy. Any points to add?
I think Jeremy has given a terrific summary of what we know. I think I would like to underscore what we currently know and what makes it very difficult, Jeremy, to prognosticate the future. We do not have a detailed understanding of infectiousness. We're inferring from the numbers of cases, and I think Jeremy's inferences but we have to recognize that we don't know anything yet. We don't understand the transmission dynamics of the disease. We don't understand yet the severity of the disease. It is very difficult during a period when the number of cases is increasing exponentially to make inferences about the severity, to understand what the mortality actually is. We don't know the number of cases. We don't know the extent of spread. This is all critical information that will inform requirements to bring the outbreak under control, and I am sure that Chinese authorities are working as quickly and deeply as they can to understand all of these factors. And so over the next several weeks and even months, have a great understanding of all of these issues, and will help us tailor and target our response appropriately. By point of comparison, in 2009, I was working in the White House helping orchestrate the pandemic response to H1N1. We knew at the end of April that the virus that was spreading, H1N1, was going to cause a global pandemic. We did not have an accurate estimate of severity until August. And that was with a virus that was reasonably well understood from being very intensively studied. So many of these answers did not become available in time fashion that we would all like. We're going to have to make decisions under ambiguity and uncertainty, and we're going to have to make decisions that have potentially very significant cost. We're seeing currently with decisions about travel restrictions, and we as an organization, we were set up to fund vaccine development. Vaccine development is very expensive undertaking. We don't take steps now. We don't have vaccine in that fashion.
Thank you, Richard. So this is for you. So I'm Singaporean Chinese, and you may be aware Saturday is the first day of Chinese New Year, is 华人新年初一. So 100 million of Chinese people around the world will be traveling to either home or visit a loved ones. We know that they're already locked in Wuhan and others as well. Our country taking enough cautionary measures. What else must we be doing? Thank you.
Yeah, no, I do. China. I'm in Singapore, so I am ingrained in it. In many ways, this outbreak, so often couldn't think of it worse. I mean, New Year, I believe I'm right in saying, 400 50 million people will be traveling alone, and then many people in the region, and then during the pandemic of 2009, which Richard refers to, we started looking to ways. We did some work in Vietnam where I was at the time. Travel restrictions are very important sense that the authorities are doing something. It's a very important statement to communities that this is serious. The actual impact of travel restrictions, at least in my opinion, are not going to be the answer. Firstly, you can't stop everybody travelling. If you stop people travelling, they often find other ways to travel that may be not so obvious. And if I were infectious now with symptoms, I'd pass it on, even though you may were sick. So travel restrictions can buy a bit of time. Very important to do. It might buy you a day, it might buy you a week, it might buy you 2 or 3 weeks. In the end, use that time to put in place the critical public health restrictions that we need. Restrictions on their own will not stop the epidemic.
Thank you. So on that note, I think, Richard, it's a good time to talk about SARS, because it was 3 years ago right here in Davos, in the shadow of the Ebola outbreak in West Africa. So what is SAPI's response to Wuhan virus, and what's on the research agenda?
Sure. CEPI, the Coalition for Epidemic Preparedness and Innovation, was established by global public health authorities, certainly important in setting CEPI up. It was created by a number of philanthropic organizations in sovereign countries for exactly this kind of. It was set up to develop vaccines against diseases like Ebola.
Greetings, sailors, Marines, and families. I'm Rear Admiral Bruce Gillingham. As Surgeon General for our Navy and Marine Corps team, I want to take a few moments to talk with you about the novel or new coronavirus. This is the virus that was first detected in Wuhan, China, and has been in the news recently. Our Department of Defense and Navy leadership have been actively engaged on this issue to help protect you and your family. The guidance and procedures we are following are closely coordinated with our interagency partners, especially the Centers for Disease Control and Prevention, or CDC. This ensures accurate and timely information is available, and all appropriate measures are taken to prevent the potential spread of the virus. Based on the information we have at this time, the overall threat of contracting the novel coronavirus outside of China is low. Colds and influenza are far more common. Navy and Marine Corps personnel and their families who have recently traveled to China should be aware of respiratory symptoms such as fever, cough, sore throat, or difficulty breathing. Should a service member or family member who has recently traveled to China experience any of these symptoms, they should call ahead to their medical provider to receive additional instructions for clinical care. There is currently no vaccine to prevent the novel coronavirus. The best way to prevent infection is to avoid exposure to this virus. To help prevent the spread of viruses, the CDC recommends the following: avoiding close contact with people who are sick, avoiding touching your eyes, nose, and mouth with unwashed hands, washing your hands often with soap and water for at least 20 seconds, or using an alcohol-based hand sanitizer. The readiness of our forces and families requires ensuring we are all in the best health to perform our duties and take care of our families. If you do become ill, take the right actions to keep others from getting sick. When you are sick, stay home or follow your local sick call procedures. Cover your cough or sneeze with a tissue, and then discard the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. And know this: my team is working on this situation, is in frequent contact with every Navy and Marine Corps medical department and facility around the world. Every healthcare provider in the Navy and Marine Corps is being provided the latest information and treatment recommendations. If we do what is necessary to protect ourselves and our families, we can avoid illness, stay healthy, and complete our missions. Be smart about your travel precautions, and what you can do to protect yourself and your family. Remember this: Navy medicine is here for you. If you need help or have additional questions, please contact your local medical representative. The CDC website has the latest and most up-to-date information. The Navy and Marine Corps Public Health Center website also has information on the novel coronavirus. Thank you for your attention to this important health information. Just as you defend our country 24/7, Navy medicine will continue to work around the clock to protect you and your families. We have the Medical Watch. Greetings, sailors, Marines, and families. I'm Rear Admiral Bruce Gillingham.
Surgió y se expandió luego a todo el mundo. La epidemia viene bajando los ritmos de contagios desde estos días de febrero.
Sí, información difundida por la agencia AFP en otras partes del mundo, neumonía viral que el virus se hace con balances con fuerte alza en Corea del Sur y en Irán, además de irrupción en Europa a través de Italia. Italia registra 6 muertos, eran 7, dijimos hoy de mañana o seguimos en 6.
7.
Llegamos a 7 ya. Convirtió en el primer país de Europa en instalar un cordón sanitario en 10 ciudades del norte. Los expertos constataron que personas contaminadas que no presentan síntomas graves tienen un tiempo de curación de unas 2 semanas y que los pacientes afectados se recuperan en un plazo de 3 a 6 semanas.
Okay, everybody, this is William from the Fincastle. I am reporting live in a very rare man-on-the-street report that I'm doing here at the Salem VA Medical Center in Virginia. This is our local VA hospital. I haven't personally been enrolled in it for years and years because I value my health and would to the VA. This is the Salem VA Medical Center. It's kind of unique because it was built in 1932-33, I believe, by FDR as part of the WPA. Well, as part of the coronavirus hysteria, they have locked down essentially every VA except for one gate in or out. And I called last night, I tried to do some finding, but basically they're not going to let you into the VA campus unless you've been screened for the coronavirus, which they're doing at a gate over there. This is not the main gate, but it's locked down right now, so that's why I'm standing here broadcasting. But they have a police officer, I believe it's a VA police officer, not a Virginia police officer, but a Veterans Affairs police officer stationed over there. And from what information I gather from Okay, everybody, this is William from the Fincastle. I am reporting live in a very rare man on the street report that I'm doing here at the Salem VA Medical Center in Salem, Virginia. This is our local VA hospital. I have personally been enrolled in it for years and years because I value my health and would come to the VA. But this is the Salem VA Medical Center. It's kind of unique because it was built in 1932-33, I believe, by FDR as part of the WPA. Well, as part of the coronavirus hysteria, they have locked down essentially every of the VA except for one gate in or out. And I called last night to do some fact finding. But basically, they're not going to let you into the VA campus unless you've been screened for the coronavirus, which they're doing at the gate over there. This is normally the main gate, but it's locked down right now, so that's why I'm standing here broadcasting. But they have a police officer, I believe it's a VA police officer, not a Virginia police officer, but a police officer stationed over there. And from what information I gathered from calling into the VA, that once you arrive here, they're going to screen you. And you have no option. You absolutely must be screened. So that led to the next question is, the question, can you opt out of it? And the lady's like, no, you can't opt out of it. And that leads to the next question, like, what if you're there and you test positive? Are they going to let you go? And she says, I can't really say for sure. She doesn't know if they would forcibly keep you here on the scene or if they would actually allow you to leave, you know, because that raises other questions. Like, if they, what are they going to screen you have it and then let you go? It doesn't really make any sense to me, honestly. The other thing is that I've learned that if you actually work here or if you come here regularly, they'll give you a pass. Now, that doesn't necessarily mean that you've been screened or that you're coronavirus free or anything. It just means they're not going to stop you at the gate. So I guess the point that I'm getting at in a roundabout way is that it does absolutely nothing. Zero jack shit for preventing the coronavirus or actually keeping people safe. It's just an illusion. I know that for sure because the guard himself is wearing a face mask. They've got a porta potty stationed out there. Even if you go in there and come out and use hand sanitizer, you're going to be covered with shit particulate because those are some of the filthiest things in the world are porta potties, especially here at the VA. So it's all just a bunch of nonsense. But what's terrifying to me is that they couldn't give me a straight answer as to whether or not they actually forcibly hold you in the VA. I'm not going to set foot in there and find out. You know, I had an interesting discussion with one of my friends earlier, and she's like, no, they could possibly hold you in there. I'm like, well, you have no idea what the VA is capable of. You know, if you're a veteran, they very well could hold you there. They've done it to veterans before. I mean, the VA has a long history of holding people against their will. Medical kidnapping is a thing, but I don't want to revisit some of that right now. So yeah, it's just another way, as George Carlin would say, it's just another way of reminding you that they can fuck with you anytime that they want to. It has, from what I've seen and from what I know about disease, it makes absolutely no sense. They're not actually preventing anything. You've got a guard up there who he's not in any kind of hazmat gear, doesn't even have one of those Michael Jackson face mask things, standing next to a shitty ass porta potty. He's interacting with people. Let's just go play the numbers. People are coming up to his little gate there. Surely, them, even if it's not the coronavirus, he's going to be exposed to some disease. That's just the nature of the gate guard at a hospital. And so he's going to stand there. So eventually what I'm trying to say is that the guard himself is going to become a vector of disease, standing next to a rotten porta potty and dealing with sick and elderly veterans coming in and out of this place all day. Couldn't give me any clear answers on whether or not they would hold you here, and they certainly couldn't give me any clear answers on what would happen if you happen to test positive. All they said for sure is that you could refuse the test. And that leads me to other questions like, you know, suppose that I was a veteran that was inclined to use the VA system, which I'm not. But if I was, would you want to come to the VA under such conditions, knowing that they're gonna screen you there and that you may not be able to leave? I know normal, regular, everyday civilians probably don't think this way, but most veterans I know are very suspicious of the VA and the powers that they have over you when you foot in this on these particular grounds, because they are federal grounds. Anyway, I think that's about it for me today. Sorry I didn't participate in the chat, but I'm here on the street, so I'll go back later after this uploads and I'm going to check everybody's comments. If you guys have anything to say about this, because I know I'm missing a few things, leave it down in the description or in the comment section or in the live chat, and I'll try and reply and get back to the studio today. But just thought I would come here because coronavirus hysteria has come to Southwest Virginia, and it's here at the VA. Thank you, everybody.
My fellow Americans, tonight I want to speak with you about our nation's unprecedented response to the coronavirus outbreak that started in China and is now spreading throughout the world. Today, the World Health Organization officially announced that this is a global pandemic. We have been in frequent contact with our allies, and we are marshaling the full power of the federal government and the private sector to protect the American people. This is the most aggressive and comprehensive effort to confront a foreign virus in modern history. I am confident that by counting and continuing to take these tough measures, we will significantly reduce the threat to our citizens, and we will ultimately and expeditiously defeat this virus. From the beginning of time, nations and people have faced unforeseen challenges, including large-scale and very dangerous health threats. This is the way it always was and always will be. It only matters how you respond, and we are responding with great speed and professionalism. Our team is the best anywhere in the world. At the very start of the outbreak, we instituted sweeping travel restrictions on China and put in place the first federally mandated quarantine in over 50 years. We declared a public health emergency and issued the highest level of travel warning on other countries as the virus spread its horrible infection. And taking early, intense action, we have seen dramatically fewer cases of the virus in the United States than are now present in Europe. The European Union failed to take the same precautions and restrict travel from China and other hotspots. As a result, a large number of new clusters in the United States were seeded by travelers from Europe. After consulting with our top government health professionals, I have decided to take several strong but necessary actions to protect the health and well-being of all Americans. To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight. These restrictions will be adjusted subject to conditions on the ground. There will be exemptions for Americans who have undergone appropriate screenings, and these prohibitions will not only apply to the tremendous amount of trade and cargo, but various other things as we get approval. Anything coming from Europe to the United States is what we are discussing. These restrictions will also not apply to the United Kingdom. At the same time, we are monitoring the situation in China and South Korea, and as their situation improves, we will reevaluate the restrictions and warnings that are currently in place for a possible early opening. Earlier this week, I met with the leaders of health insurance industry who have agreed to waive all co-payments for coronavirus treatments, extend insurance coverage to these treatments, and to prevent surprise medical billing. We are cutting massive amounts of red tape to make antiviral therapies available in record time. These treatments will significantly reduce the impact and reach of the virus. Additionally, last week I signed into law an $8.3 billion funding bill to help CDC and other government agencies fight the virus and support vaccines, treatments, and distribution of medical supplies. Testing capabilities are expanding rapidly day by day. We are moving very quickly. The vast majority of Americans, the risk is very, very low. Young and healthy people can expect to recover fully and quickly if they should get the virus. The highest risk is for elderly population with underlying health conditions. The elderly population must be very, very careful. In particular, we are strongly advising that nursing homes for the elderly suspend all medically unnecessary visits. In general, older Americans should also avoid non-essential travel in crowded areas. My administration is coordinating directly with communities with largest outbreaks, and we have issued guidance on school closures, social distancing, and reducing large gatherings. Smart action today will prevent the spread of the virus tomorrow.
As the coronavirus grows, President Trump has suspended travel between the United States and most of Europe as the World Health Organization finally declared coronavirus a pandemic.
Today, the World Health Organization officially announced that this is a global pandemic. At the very start of the outbreak, we instituted sweeping travel restrictions on China and put in place the first federally mandated quarantine in over 50 years. We declared a public health emergency and issued the highest level of travel warning on other countries as the virus spread its horrible infection. We will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight. These restrictions will be adjusted subject to conditions on the ground. There will be exemptions for Americans who have undergone appropriate screenings, and these prohibitions will not only apply to the tremendous amount of trade and cargo, but various other things as we get approval. Anything coming from Europe to the United States is what we are discussing. These restrictions will also not apply to the United Kingdom. We are all in this together. We must put politics aside, stop the partisanship, and unify together as one nation and one family.
Of course, Democrat haters will hate as they claim President Trump has done nothing.
Donald Trump saying nothing to worry about here. Move along, just like the Chinese.
Yeah.
The 2019 to 2020 season of the NBA has also been suspended indefinitely after a player on the Utah Jazz tested positive. The NCAA March Madness will go on with empty seats. Meanwhile, the first positive case involving a major celebrity has occurred in Australia as Tom Hanks and his wife Rita Wilson offered this statement to Deadline. "Hello folks, Rita and I are down here in Australia. We felt a bit tired, like we had colds and some body aches. Rita had some chills that came and went, slight fevers too. To play things right as is in the world right now, we were tested for coronavirus and were found to be positive." Hanks and his wife are in their early 60s, the beginning of the age group that is strongly being warned to restrict themselves from public places as much as possible. And we are gradually learning of the effects of the virus on the lungs of those infected. As the Daily Mirror reported, these X-ray images show the damage that coronavirus is doing to the lungs of people who catch the potentially deadly bug. Doctors have been able to identify specific abnormalities caused by COVID-19, and the patterns are similar to those found in patients from SARS and MERS outbreaks. The scans show patches in the lungs, and the experts' findings could lead to a quicker diagnosis and help to prevent infections. The first person to catch the flu-like illness had previously told how it hit him like a train and left him suffocating and in blinding pain for weeks. Meanwhile, as The Hill reports, federally funded tests conducted by scientists from several major institutions indicated that the novel form of coronavirus behind a worldwide outbreak can survive in the air for several hours.
Well, SARS was also a coronavirus in 2002. It infected 8,000 people, and it killed about 775. It had a mortality of about 9 to 10%. So that's only 8,000 people. In about a year, in the 2.5 months that we've had this coronavirus, as you know, we now have multiples of that. The seasonal flu that we deal with every year has a mortality of 0.1%. The stated mortality overall of this, when you look at all the data, including China, is about 3%. It first started off as 2 and now 3. I think if you count all the cases of minimally symptomatic or asymptomatic infection, that probably brings the mortality rate down to somewhere around 1%, which means it is 10 times more lethal than seasonal flu.
Last week, Republican members of Congress were told that there's a good chance most people in the United States will eventually be exposed to the coronavirus. They weren't suggesting that most people will become infected or ill, but that most will encounter the virus. Meanwhile, the super rich, as expected, jet off to their bunkers, heading off to countries largely unaffected and taking their own personal doctors and nurses with them, just as we've been documenting for years. John Bound reporting.
Now it's easier than ever to have band.video on your iPhone. Simply go to band.video with your Safari browser. Then you click the share button at the bottom of the screen. When the menu comes up, you simply click Add to Home Screen. It will then ask you to name...
Juliana Chan. I'm the Chief Executive Officer of Watertight Group and a science communicator based in Singapore. We are here today to discuss an unfolding situation, that of a novel coronavirus, the Wuhan virus. It is named because it first appeared in December in a seafood market in Wuhan, the largest city in Hebei province in central China, with a population of 11 million. So it has been compared to SARS, which caused the deaths of nearly 650 people across mainland China. And to date, we have already had more than 500 cases and 17 reported deaths. Just today, a few hours ago, Singapore, where I'm from, announced its first confirmed case. So we have 3 experts with us who helped us put in context the unfolding situation. On my left, we have Jeremy Farrar, Director of the Wellcome Trust in the UK. Next, we have Dr. Richard Hatchett, Chief Executive Officer of SAPI, stands for Coalition for Epidemic Preparedness and Innovation. And finally, we have Mr. Stefan Bancel, Chief Executive Officer of Moderna, a US-based biotech company. So I'll start with trying to understand what we're dealing with right now. And for that, Jeremy and Richard, could you kindly tell us what we know now of the virus and what do we expect to happen next?
Yeah, thanks very much, and thanks to everybody for joining. Just back a little bit, so you can appreciate what I'm going to say. I'm an infectious person by background, worked very, very closely with China, the SARS outbreak, and spent 20 years living in Vietnam and working very closely with many countries. So that's my background of where I come from. Infection, which has come about from the beginning of December, started, you say, in the animal market in Wuhan, and was a virus that was infecting animals, most likely, I think, bats in that market, and it crossed this barrier and it came into infecting humans who were visiting that market. Subsequently, through the month of December and then the days of January, that infection spread from animal to human, but then most importantly from human to human. And now we are sort of the end of January, so we are about 6 weeks into this outbreak. This virus can now clearly spread between humans. It's spread by the respiratory tract. That means that somebody with symptoms would have a cough, a sore throat, and would pass it to somebody else by coughing or sneezing in the same way that influenza is spread around people. It is not SARS. The virus is in a similar family to SARS, but this looks different to SARS. And the difference is probably it's easier to pass between human beings. SARS was quite difficult to pass between humans, and people were most infectious when they had symptoms, and therefore it was relatively easy to bring the epidemic under control. When an infection spreads between humans easily, it's actually very difficult to bring the epidemic under control. And so there's a very big difference between SARS and what we believe we know about this virus so far. The infection is now spreading, of course, across China. Many cities in China have reported cases. Indeed, Singapore reported a case, and other countries have. We can expect that there will be many more cases in China, and that there will be many more cases in parts of the world. I would stress also, in comparison with SARS, that the infectious rate will probably mean in the long term that it will cause less fewer people will die. 10% of people died in SARS. I suspect the mortality rate with this infection will be lower than that as it spreads to a much wider population. So what we have is a broader infection with probably a less marked number of people, percentage of people dying. In some ways, from a public health perspective, is harder to deal with. We can't the future, and we're living in a period of great uncertainty at the moment because we don't have all the information we need. China recognized this, it shared the information very quickly. That was different to SARS, and therefore it alerted the world to this outbreak happening. That would not have happened maybe 10 or 20 years ago, and we should congratulate China in the way they've been open and sharing with the information. The future, the world has got to think about how we can prepare now by developing vaccines. Richard will talk about that, drugs that may counter infection, but also what we do at a public health and societal level to try and prevent the epidemic spread further than it might otherwise do.
Thank you, Jeremy. Richard, do you have any points to add?
I think Jeremy has given a terrific summary of what we know. I think I would like to understand what we don't currently know and what makes it very difficult, as Jeremy is saying, to prognosticate the future. We do not have a detailed understanding of infectiousness. We are inferring a lot from the numbers of cases, and I think Jeremy's inference are strong, but we have to recognize that we don't know anything with certainty yet. We don't understand the transmission dynamics of the disease. We don't understand yet the severity of the disease. It is very difficult during a period when the number of cases is increasing exponentially to make inferences about the severity, to understand what the mortality rate actually is. We don't know the number of cases. We don't know the extent of spread. This is all critical information that will inform what is required to bring the outbreak under control, and I am sure that Chinese authorities are working as quickly and deeply as they can to understand all of these factors. And so over the next several weeks and even months, we will have a great understanding of all of these issues, and it will help us tailor and target our response appropriately. By point of comparison, in 2009, I was working in the White House helping organize the pandemic response to H1N1. We knew at the end of April that the virus that was spreading, H1N1, was going to cause a global pandemic. We did not have an accurate estimate of severity until August. And that was with a virus that was reasonably well understood from the beginning and very intensively studied. So many of these answers may not become available in the time fashion that we would want, and we're going to make decisions with ambiguity and uncertainty, and we're going to have to make decisions that have potentially very significant cost. We're seeing that currently in China with some of the decisions about travel restrictions, and we as an organization, CEPI, we were set up to fund vaccine development. Vaccine development is a very expensive undertaking. If we don't take steps now, we won't have vaccines in a timely fashion.
Thank you, Richard. So this is for you. So I'm Singapore Chinese, and you'll be aware that on Saturday is the first day of Chinese New Year, is 华人新年初一. So hundreds of millions of Chinese people around the world will be traveling to either go home or visit a loved ones. We know that they have already locked down the city of Wuhan and others as well. Are countries taking enough precautionary measures? What else must we be doing? Thank you.
Yeah, no, I do know it's China. I was born in Singapore, so I am ingrained in that. This outbreak, as so often, couldn't be happening at a worse time. I mean, a year, I believe I'm right in saying about 450 million people will be traveling in China, and then many people in the region and globally. During the pandemic of 2009, which Richard refers to, when in fact we started working together in some ways, we did some work in Vietnam where I was living at the time. Travel restrictions are a very important sense that the authorities are doing something. It's a very important statement to communities that this is serious. The impact of travel restrictions, at least in my opinion, are not going to be the answer. Firstly, you can't stop everybody traveling. If you stop people traveling, they often find other ways to travel that may be not so obvious. And in the end, if you are if I were infectious now with no symptoms, I could pass it on even though you don't know I was. So travel restrictions can buy you a bit of time. That's very important to do. It might buy you a day, it might buy you a week, it might buy you 2 or 3 weeks. But in the end, you have to use that time to put in place the critical public health interventions that you need. Travel restrictions on their own will not stop this epidemic moving.
Thank you. So on that note, I think, Richard, it's a good time to talk about CEPI because it was launched 3 years ago right here in Davos in the shadow of the Ebola outbreak in West Africa. So what is CEPI's response to Wuhan virus and what is on the research agenda?
Sure. CEPI, the Coalition for Epidemic Preparedness Innovations, was established by global public health authorities, chaired an important role in setting CEPI up, and was funded by a number of philanthropic organizations in sovereign countries for exactly that kind of event, set up to develop vaccines against diseases like Ebola that we know about, and to be prepared for the next unknown disease, the next epidemic, so that we could respond rapidly. So CEPI is focused exclusively on vaccines. We have been working very aggressively over the last couple of weeks to assess the situation first, to try to make determinations about what steps are appropriate. And as the epidemiologic situation has unfolded, a sense of what we need to do has become clear, and our sense that we need to move faster and move farther, perhaps, has also become more clear. Today we can announce, in fact, this is the first time that we've announced this, 3 partnerships to develop vaccines against the novel coronavirus, 2 with partners that CEPI already works with. One, a company called Inovio that will manufacture a DNA vaccine. A second with the University of Queensland that will manufacture a recombinant subunit vaccine. And third, a new partnership, in fact, but one we've contemplated for quite a long time with Moderna, and with the U.S. National Institute for Infectious Diseases to develop an mRNA vaccine against coronavirus. Our hope is to have these vaccines developed very rapidly and move them rapidly into human clinical trials, perhaps as early as summer. And I would like to give Stefan to talk about his program.
Thank you, Richard. Stefan, maybe you could share with us about the vaccine and when we can expect.
Good. So thank you again for having me and having the company. So I'll say a few words about Moderna so you understand what we're trying to do. So Moderna is about a company based in the US. And what we're trying to do as government, through NIH and with CEPI, is to use technology. So Moderna, what we do is we make RNA medicines, which is a technology where we inject basically instruction into humans for humans to make their own medicine, using your own machinery of your cells to make your own protein as medicine. The company currently has 16 clinical trials around the world, including with global company like Merck or MSD on this world, AstraZeneca and others. We are in oncology, in cardiology, in rare genetic disease, in autoimmune disease, and of course, the topic of today, infectious disease. So far, we have started 9 clinical studies around for infectious disease vaccines. We have dosed more than 1,000 people, and we've done a few viruses like pandemic flu virus, H10, H7, RSV, and also HMPV, PIV. So if you think about mRNA, the very interesting thing for fast response is that mRNA platform. And that provides the potential for 2 benefits. One is efficacy, because if you think about it, by using the human cell to make the protein of a virus, which is how a vaccine mechanism works, we are trying to mimic infection, but without giving the virus. The second piece, of course, is manufacturing. If you look at traditional vaccine technologies, it takes a lot of time to do because every product is unique. In our case, because we have information-based molecule, messenger RNA, it's the same technology we use for flu vaccine that have already been in the clinic, or vaccine that we are in the clinic with BARDA, US agency, or the project we're working on for this new virus. So it provides speed to get very quickly clinical grade material. You can start quickly clinical trial. So if you think about the company, our number one focus in vaccine, of course, is to develop commercial vaccine for viruses. There is no vaccine on the market today, and a good example is CMV, cytomegalovirus, which is now in phase 2 in the US. That's another very important virus that affects birth defect. And so what we've always wanted since we started this company is to say, because it's a platform and because of what I describe as potential benefits, it would be a very nice tool for emerging pathogens. And so we partnered, since we started the company, with government agency like BARDA, which is part of the Secretary of Health in the US, or DARPA, which is the Department of Defense, also part of the Gates Foundation. And we're, of course, pleased today and to be partnering with CEPI to join forces. So the project here is we're providing the technology to help. And so design of the vaccine has been done over the last few weeks at the NIH in the US, because they have access to the sequence of the virus. As Jeremy said, the US government got access very quickly to the sequence, which is very important information to start making a product. Without that, you cannot do it.
Stefan, do we have a timeline on this?
We don't have a timeline yet, because this is an endeavor that has been done before. Trying to go so fast for a vaccine has never been done before. We have done 9 vaccines in the clinic. We have never done it on a compressed time that we are doing now, which is why we have to work together. The government is doing the design, because we have great expertise there. What we are doing is make the product quality, clinical grade material. Thanks to the support of CEPI. CEPI is actually funding this. I'd like to give a lot of kudos to the organization, because I reached out to Richard Monday, and by this morning the agreement was in place, formally signed by both organizations, which is really remarkable. As Richard said, we have been talking for a long time, POL and then Coronaviridae. And then we will provide this material to NIH, who will be running the clinical study.
Thank you. Thank you. That's terrific updates. At this point, I would like to open it up to the floor. Do we have any questions from the audience, please? Okay, the 3 of you. We'll collect 3 questions. Introduce yourself and give us a short, sharp question. Thank you.
Thank you. So I'm a journalist from China State Media. My question is to Dr. Farrer and Mr. Hatchett. Because you mentioned that maybe the imposition of travel restrictions might not work, because people might still try to find ways to go out and in of the city. Is it because that Wuhan is so large, it has more than 10 million residents, that this measures effectiveness might decrease? And because such measures on such a city of large scale has never been imposed, but I think there's any historical precedents that we can and other cities who has been shut down can use to ensure that public panic won't escalate, and we have enough resources and necessities to provide to the Wuhan people.
Thank you. And the next question from this gentleman. I'll collect a few.
Yeah. Thank you. My name is Zicheng Wang. I'm with China's Xinhua News Agency, the state news agency. I was wondering, Ms. Hatchett said you have started 3 partnerships to develop the vaccines. Of enormous importance to the Chinese people right now. How confident are you are going to start the human trial, as you said, in summer? Could you give us a more explicit timeline on this? How confident are you are able to do this? Have you been working with any Chinese authorities or government health authorities? Thank you very much.
Maybe the 3rd question, and then we'll answer.
This is from question as well. I'd like to know any risk of the sugar transmission due to the block of the city, and any suggestions can you offer to the government in terms of making sure that local treatment capacities resources are sufficient? I'd like to put forward the question to Mr. Farrer and Mr. Hatchett as well. Thank you.
I think we'll start the travel historical experience, maybe?
I think Jeremy is deferring to me. This is actually a topic that we looked at intensively. Just part of my background also helped the U.S. develop its national pandemic preparedness in 2005 and 2006. And the stimulus for that was avian influenza, H5N1, a flu that had a very high mortality rate. And we faced a prospect at that time of facing a virus with a mortality rate when we had no other control interventions. And so in such circumstances, truly the only thing we have are non-pharmaceutical interventions, including travel restrictions, but also including canceling gatherings and closing transit systems and closing schools. At that time, we looked at how could you have those interventions implemented in a way that maximized their benefit and minimized the cost. And we developed an approach that we called mitigation interventions. And CDC published guidance on this several years ago. There is a literature which I certainly encourage Chinese authorities to evaluate and review, and certainly would be happy to talk with them about that. That's not my current job. I do think one thing that's important to understand is that when you don't have treatments and you don't have vaccines, non-pharmaceutical interventions are literally the only thing that you have. And it's a combination of isolation, containment, infection prevention and control, and then these social distancing interventions. There is historical precedent for this. We looked intensively, did an intense analysis of the use of non-pharmaceutical interventions in U.S. cities during 1918. And what we found was that cities that introduced multiple interventions in the epidemic had much better outcomes. And the challenge, of course, is it's very difficult to sustain these interventions because they impose enormous costs. And they also can produce enormous anxiety on affected populations. It is actually the reason why it's so important to move quickly to develop things like vaccines.
Thank you, Richard. I think the question from Xinhua is, what are some of the efforts with China on this? How are you collaborating with China?
Sure. So members of my staff do have, through their personal professional networks, many of them come out of a biotech pharmaceutical background. We do have connections with Chinese companies and with public sector officials. Dr. George Gao, who's known to all knows the Chinese environment, the current director of China CDC, in fact served on CEPI's Scientific Advisory Committee. So we have reached out. We are in discussions, but discussions are not as mature as the partnerships that I announced today.
Okay, we can take a couple more questions.
Oh, very quickly on the timeline. So the timelines that I mentioned of potentially vaccines into clinical trials in the summer, Dr. Fauci from NIAID also mentioned the timeline to the Moderna program. Those certainly depend on the development programs going well. I think they are our best estimate of how quickly we could feasibly get there if we don't encounter roadblocks. It will also be very important for our regulatory partners to work with us and to help us understand what exactly is required so we can move vaccines into clinical trials. The advantage of the platform technologies is that they have been in with the same platform vaccines, but the same platform have already been in both Moderna and for one of our other partners. So we think that will expedite the ability to move these into clinical trials.
More questions? The lady on this right. Maybe we'll take both.
Yep. Okay. Yeah. So just first of all, how concerned are you with Chinese New Year on the way? What else, if you were using China, what other precautions could you take? We've got 2 more cases in Hong Kong as well. Hong Kong, has learned from SARS, but what else could China do? And lastly, why is this particular infection causing so much panic?
Maybe the next question.
And speaking to So yesterday there were 448 cases, of which 102 were defined as severe or critical, which is actually about a quarter. So coming back to the what the case fatality rate is,
of Wirecast.
10% for SARS and up to 37% for MERS, but MERS was less widespread. But this could be actually in what we're looking at, up to 25%. If we assume that, we know that it will take a long time, days, not weeks, to actually die from a disease, and we're looking at the comorbidities that exist in diabetes, hypertension, coronary artery disease, usual suspects. In addition, the confluence of this is a pathogen which the lungs in a heavily polluted environment in the middle of winter with several other pathogens, and we wouldn't. I'm just trying to understand the dimension of the spectrum that we're looking at, and not downplay or over.
Yeah. So as Richard, when you're in these circumstances and you do not have drugs specific and you do not have vaccines, you're reliant on classic public health measures, and what that means is hand washing and social distancing and restrictions where it's at all appropriate, masks. And earlier you do that within a city, the more chance you have for reducing. But what it does effectively is buy you some time to do the other things that are going on, including the vaccine development. Why panic? The world has sort of been prepared, really sort of, if you like, for getting ready for something like this since SARS 18 years ago, and SARS left deep on particularly the Asian and Toronto systems, and then of course we have the pandemic. So whenever you see an animal virus coming across to humans, passing between humans, causing both mild and severe disease, of course the world is now really primed to know about that. And inevitably that causes a degree of panic. I don't think you can we don't overstate the panic here, because there is so much uncertainty, and we want to keep a calm, moderated approach to it. You do have to take this incredibly seriously, because you don't often get virus coming to humans, passing between humans, and being spread by the respiratory route. It's what Richard and I and many others would have been frightened of for the last decade. The only thing on severity and fatality rates, and this is just a general statement across all of the epidemics, going back to all of them, including Nipah, that I've been involved in since 1999. In Maine, at the beginning of the epidemic, you see the more severe end of the spectrum. They're the people that seek hospital care, they're the people that seek intensive care, and that usually dominates you early. You can't tell for some weeks, actually, until you see the full spectrum of illness, quite how severe the spectrum is. And at the moment, we're in that period of uncertainty. Yes, 85% of the moment of the people may have had severe disease or be dying. We don't know what that really means in terms of the denominator in the population that has infection, how many severe, and how many are dying. And we guess, but it was a guess, as Richard said earlier. And we sort of have to live at the moment with that degree of uncertainty and not be intimidated by it.
We've run out of time. Uncertainty is the last word we heard. I would like to thank our three speakers and our experts for joining us today at the briefing room. Thank you very much for joining us today.
Thank you.
This is a demonstration of Wirecast.
Epidemiólogo, especialista en la epidemiología de las enfermedades infecciosas y medicina preventiva.
Acción criminal. Oscar Valderas.
This is a demonstration of Wirecast.
Suggest band.video. You will now have band.video app on your home screen, despite the fact that Tim Cook tried to stop it. The globalists think you're lazy, but by taking a little bit of action, you can override the app and then tell others about it so they can get the app. So
welcome to the Best Damn Podcast. I am your host, John Keane. As always, I would like to thank you guys for joining me. Ask that you please add, follow, and check us out, www.spreaker.com/user/Best Damn Podcast. Also, if you're watching here on YouTube, please make sure to like, share, comment, subscribe, and don't forget to click that bell. That way you guys can get all of the notifications. And also subscribe to our backup channel, BDP2 at youtube.com/Best Damn Podcast. And guys, keep in mind, we are completely viewer powered. So that means we're fully funded and supported by you, the listener, the viewer. So consider donating and supporting by going to paypal.me/the Best Damn Podcast, venmo.com/Best Damn Podcast, or you can even become a patron for $1 a month at patreon.com/Best Damn Podcast. Well, guys, we've got pretty major breaking news today. We were going to continue the Forbidden Knowledge series, but in the light of these new circumstances that have arisen, which we did predict, by the way, if you guys don't remember, the coronavirus has now been labeled a global pandemic. A global pandemic. And this was declared by the World Health Organization, not to mention, not too long ago, I believe about an hour ago, President Trump addressed everyone, basically, outlining the plans for the country moving forward in light of the pandemic being announced. And one of the new changes we will be experiencing is a travel ban, at least for the next 30 days, to Europe. Guys, I have some, disturbing things to kind of show today. Concerning this, so this isn't like meant for children or anything like that, and people can go ahead and toot their fear horn, their fear porn horn, but the truth is we got to show what's going on. We gotta be aware. I absolutely refuse to sit around and be in ignorance, and I refuse to let fear dominate me to the point I'm not aware of what's taking place. So it's a tricky spot to be in, but I think we're all grown-ups here and we're all mature enough to handle what's taking place. I do want to shout out a few of you guys in the chat room. Shoshana Rose, a wonderful moderator, Karen Wager and Jeffrey McLean. Everybody be very respectful to them. They're helping me out, so I appreciate that. Joe C, Strike Force Delta, Tracy Campbell, appreciate all of you guys. Ice to See 711. Who do we have here? Leah Jellin. I'm sorry if I got your name wrong. Wildman, my wonderful mod. Susan Baker, Lisa Post. Thank you. I appreciate all you guys. Leon Connor, Lou Machado, Zach, Despina Pasuli, and SBVA. Hey, brother, I actually got a message from you today. Thanks. Daniel Phillips. I appreciate all you guys for joining me. And looks like we have Gerardo. I can't even say that last name, but thank you for joining, bro, and Tim Marcano. So the coronavirus cases passed 115,000 worldwide. I think we'll go ahead and kick it off with the World Health Organization and their declaration of a global pandemic. I mean, it doesn't get any more, simple than that, right? So I'll let you hear it from them yourself.
Thank you, Tariq. Good afternoon, everybody. In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries. And 4,291 people have lost their lives. Thousands more are fighting for their lives in hospitals. In the days and weeks ahead, we expect to see the number of cases the number of deaths and the number of affected countries climbed even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never been...
I tell you what, though, what it does change, guys, what it does change, and I didn't want to bore you with all the details. You basically get the gist right there, and we're going to be looking at the details actually ourselves. So I'm always a big, proponent of, going over the fine writing myself, considering I don't trust none of these people as far as I can throw them. But I mean, that's just me, I guess. We've got this being labeled a global pandemic. Now, if you don't remember, I could refresh your memory a little bit, I guess. With some of the documents that we had, remember, you guys, the anonymous resource, January 31st, that leaked out that this wouldn't be labeled a global pandemic until when? Mid-March. And where are we at, guys? 3/11. Isn't it funny how they chose 3/11, by the way? Right? Isn't it funny that they picked that date? When you look into the occult kind of aspects of all these things. Anybody know what, 3 times 11 is? Right? Anybody know the answer to that? And why that would be significant to, doing something of this sort, right? Also, this is the 9-year anniversary of Fukushima, I believe, and I've even got an article and some information showing that this is like a triple tragedy now, basically, in Japan. So there's a lot of weird things concerning this date in particular and why they chose it. Now, according to this, anon here from January 31st, we knew that the eruption would take place in Italy, that's where the pandemic would burst out, and that's where they were basically going to, work their model of medical martial law from that point. And that's exactly what we've seen. As you guys will see when we go through this further, it went from, what did I say the other day? Did I say 12 or 16 million people were locked down in Italy? Well, now it's 60 million people are locked down in Italy. So major, that's major. That's huge. An entire country, big time, right? And all their supermarkets and everything are now shut down. And I think that a lot of people have bought into the other side, right? We've seen propaganda from both sides. We've seen one side saying, fear, 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 be terrified, be scared, right? You're going to die, right? You got that side of it. And then you got the other side. It's like, it's not real, man. Don't sweat it. Nothing's going to happen. Chill back, right? And as always, right, it's not really good to rush to one extreme or the other, right? All things in moderation, even moderation. And this is just another example of how true that really is, right? So now the people saying it's fake look like idiots, right? Because there are real deal events or consequences as a result of this taking place, and people are dying, no matter if it's from a real or perceived virus. I don't know, and I can't prove it either way. I could just show you what I've shown you in the past, which is the studies from Delhi University, leading to it kind of being biological and weaponized. not found in nature. And that study was made to be withdrawn. So who knows, right? Little suspicious, little conspiratorial right there. So I could show you that, but that doesn't really prove a whole lot. We've had people saying, hey, it's the nemesis system, and it's, this is why they're getting respiratory troubles and pneumonia, and this is why they're dying of sepsis, so there's that angle to look at it. And then we have people talking about 60 gigahertz, and all the places that this is erupting in are, set up for 5G, right? So we've got a few different angles that people are taking on this, and you can even look in the Dean Koontz book, right, and how this thing is been predicted. What was it? I think I've got it right here. Yeah, publication date of May 1981, man. And they're talking about in the rDNA, and we've heard nothing but RNA here, right? Wuhan 400. You hear Trump talking about, oh, it'll miraculously disappear, and then boom. And around 2020, severe pneumonia-like illness will spread throughout the globe, attacking the lungs and bronchial tubes, resisting all known treatments. Almost more baffling than the illness itself, it will be how it suddenly vanishes. Strange, man, strange. We've pointed out other things as well, like these, right? The Illuminati cards, which every single time, even for Fukushima, right, popped up and shown their ugly faces. That's down to 9/11, the Twin Towers. That's down to the Pentagon. I mean, you name it, man. Every time one of these major Las Vegas shooting, anytime you see a major world-changing event, there is at least one or two Illuminati cards to go right with this thing. So this has been no different by any means, no different. And, can I prove that, right? Can I prove that? No, I can't really, right? I can just point it out to you and say, yeah, that's weird as shit, And we have seen a lot of really coincidental deaths, right? Like, I think I got it right here. In Iran, the vice presidents and all these different things, these political opponents that are dropping off like flies. But I think the number one thing to focus on, is there appears to be an agenda behind all of this. We've spoken many times about how the artificial intelligence system is already in place, right? You're already seeing biometrics, retina scanning, facial recognition, all of this, right? That is being implemented. Even you pick up your smartphone, it has your thumbprint, whether you gave it permission to or not. Matter of fact, all of our phones now are created where you can't even take the battery out. And that's for a purpose too, so they can remotely turn your cameras and microphones on, and you can never stop them from listening. So, I mean, they've got those type of things already in place. We've already seen the erosion of our freedoms, our liberties. We've seen them testing, shutting down YouTube, Facebook, all this crap for months, for the last year or so, right? Like they're practicing for something. I showed just yesterday, was it, the federal ICE agent that committed suicide in New York, and his letter talking about how our economy was terminally ill and that they were making a plan to save the federal government, but it would basically consist of what we're seeing now, the stocks crashing and a martial law type of situation to strip all of us of our guns, our rights, push us into internment camps, aka FEMA camps. And we've seen this kind of chipping away at us through a lot of these disasters, like the hurricanes in Houston, the fires on the West Coast. A lot of these things have already set up shop, so to speak, in a lot of different places. Well, lo and behold, we have shown that in October of 2019, Event 201, right? I'm not going to read all of this, but just the gist of this was a pandemic exercise that simulated a series of dramatic scenario-based global pandemic, right? And this was using governments, private businesses and corporations funded by Bill and Melinda Gates, and the World Economic Forum. So this was huge, guys, very huge. And at the same time as this was taking place, which is more than a coincidence, I think, October of 2019, the Manpower Guidance for Activation and Deactivation of Reserve Component Marines ordered to active duty ISO defense support of civil authorities. Guys, this is the one that really, really sketches me out the most. You say, what is this, John? If you haven't seen it, well, just concentrate on this. Civil. That means in the United States. Well, you say, well, they just can't deploy our armed forces on us. You're right. And they don't use them. The only ones that have that kind of access are the Marines and National Guard, reserves, right? So that's who they chose. That's who they chose. They chose the branches that they actually could use here. And the only way that they'd be able to actually activate them, guess what? Was when a governor declares a state of emergency. And when you're looking at what's going on right now, state of emergencies seem to be pretty damn normal. Let me show you. Let's see where we're at now. Yeah, 12 U.S. states have declared state of emergency. And not just that, too. We've seen in many headlines and articles before all this. Popped off, really, that they were calling for Trump to declare a national emergency. That would also enact these forces, by the way. So it's a national emergency by the president or the governor from each respective state declaring a state of emergency. Jeffrey McLean, John, you can't even find half of this stuff anymore, bro. I know, guys. I know. I'm sorry about that, too. You know, I am. But I've been on top of this for a while, so I know where to look. And I know what they use and all of that. I'm not sitting here stroking my ego either. I'm just saying, like, I've already known where these things were at because I've paid attention to this one in particular, the Civil Act. You know, that stuck out to me like a sore thumb. I thought, what in the hell are they doing this for? Right? And I've just been kind of riding the wave, waiting for the moment. And the event 201, there was just a lot of things that stuck out to me really big. And I knew that we were really close. And when they was talking about the economy at an all-time high, man, my mind always flashes back to the Bible. And I don't want to get all weird and religious on you, but you know, Babylon falls when it's at its peak, okay? So when I say we were peaking and stuff, I'm like, oh shit, here we go, you know. And the first kind of blow we're dealt is an economic crash, and this is when plague and famine is released all at the same time. And after that, man, it's all bad. So this will happen in phases. This will be a series of kind of simultaneous, you know, one hinging off the other events, big events, if this is what we think it is. And I've already heard talk. I was watching, and I know he's a shill, so go ahead and save that part. But I watch everybody to try to see what they're saying. I can tell sometimes, and I'm sure you can too, by what narratives they're trying to feed us, by the propaganda, which direction they're going to push things in, right? And I was watching Alex Jones, so I was watching some extreme, you know, conspiracy shit. And I was watching mainstream Fox and the other side, CNN and MSNBC. And you know what the propaganda line is right now, guys? And I'm telling you, this ought to make you straighten your ass up if you haven't yet. They're talking about Trump hasn't done anything. He hasn't done anything, right? This is his fault. Or the other side saying they're trying to use this against him. He needs to take action. This is they're trying to pin this on Trump, right? So both sides, man, are pushing the same damn agenda. They're just painting it up pretty in a different way. And guess what that is? You know what action they want him to take? They want him to declare a national emergency, guys. And they're even making statements to convince you it's a psychological tactic, right? You know how when you're a kid or something and your brother or something won't let you have a bite of his candy bar or his candy, and you're like, that's cool, I don't want it anyways, right? Reverse psychology, right? They're doing that to us. They're saying the people will be pissed off if he don't declare a national emergency, right? So they're making you think, and you're sitting at home like, damn right, I'll be mad, right? No, you won't, you damn idiot, right? Nobody's asking for that. They're trying to convince you that you want that. They're telling you what you want instead of you telling them what you want, right? And that's how you know when both sides are saying the same thing, but just a little bit different. And I've reached out to a few friends today, and I told them, a lot of the things I've found. And I'll show you some videos today to kind of support what I'm about to say that you haven't seen yet. I would recommend, and this is the truth, I would recommend that everybody stock up on some stuff, okay? Stock up on some stuff, and I'm being really serious right now. Get you some food, get you some rice, get you some water, get you some first aid, Make sure that if things, go to hell in a handbasket, that you can take care of you and yours. All right, please do that for me. One of the things that I've always seen associated with this stuff when, economies collapse, because you got to think, when the economy collapses, that's your country that's collapsed. That's the government that's collapsed, okay? They go hand in hand, right? And we've seen when the Soviet Union collapsed. Some of us did. I was a little feller, but, it does happen. It does happen. So, and nobody can bail us out. All right? We're the ones who bail everyone else out when this happens. Right? So no one will bail us out. The whole world economy is hinged on us. And I've always told people that's why it will happen here. That's why when the show yesterday we were talking about Babylon has fallen and the merchants are weeping over Babylon. That's why, man. Because it's the world economy that hinges off of it. So just, I know a lot of myself, I live very, very day to day, right? Here in Cincinnati, and I can show you also, Ohio has declared a state of emergency, all right? Ohio has already declared a state of emergency. And I live in between Cincinnati and Dayton is where I live, actually. Right here, right? Cincinnati mayor declares state of emergency amid coronavirus outbreak. So in Dayton, they already have cases here in Dayton, at least one, and others being tested. The food pantries here are already shutting down. We have already been out of medical supplies and bleach, hand sanitizer, all of those type of things. We've already been out of those, but now, right now, we're starting to run out of things like beans and stuff like that. Food is starting to empty off the shelves. So, it would be a beautiful place if everyone in this country would pull together right now, and if you had the opportunity to prepare, you would, and you would help those who can't. That would be beautiful if we all could come together that way. It would be beautiful if our government wasn't lying fucking snakes, and, they told us the truth about the situation, and instead of trying to capitalize on it to further their agenda of a police state and depopulation, they would help us and help us prepare and things like that. But that's not going to happen. That's not the reality in which we live. So I'm telling everybody to please, prepare, get yourself together. If you can help anyone, do it, do it. Please, be a good person. Don't think that saving your money is going to help you, is my point. Because when these things, the further this goes, all right? And you won't know it, man. One thing that's always stuck out to me, and I'm going to sound really weird and conspiracy here, but I'm telling you, it's important, and I feel like it is in my soul. I was watching the X-Files. Remember when the X-Files went off the air for a long time, and then they came back for like 6 episodes or some shit like that? Anybody remember that? Anybody in the chat room remember that? Well, they were talking about the event, the reset, and and it was like one of the most revealing TV series I ever had. Now I've ever seen. So I wonder if we can even find that line. But they say,
This is a demonstration
and this is what's crazy. They talk about the markets crashing. I wonder if it's that. Here, I would love to find this little clip. I wish I would have had this ready. Let's see if it's down here. Let's see if we can find this. Okay. Well, I would love to find it. I don't think I'm going to be able to find it while I'm on here with you guys. Return. See if I can find that, man. Okay, well, in the episode, and I will find it, the end of the world. Yeah, the end of the world. Let's see if this says it here.
Wirecast.
Oh, come on, man.
Relationship ended up having close to 6 the last time, and I think.
All right. Okay, basically, so that's enough of that. But I'll show you when I get a chance, or maybe the next clip I show you, I'll find it before you come back. So the X-Files talking about the end of the world and all these things taking place, and they look at each other and they say it'll start on a Friday, right? It'll start with the markets crashing. I mean, they're literally telling you how all this shit begins. Well, has anybody noticed that Trump's weird ass little travel ban to Europe? It doesn't start till Friday, right? And how we've seen them kind of biding their time. Like, it's already met the criteria of a pandemic a while ago. But I told you guys, because we had that document I just shown you from the Anon, that they were waiting. Yeah, Friday the 13th. That's fucking right, Tim. That's right, bro. That's what I'm trying to get the point across here. So you might have a few days to get your things together. And I'm not saying it'll all hit the fan Friday the 13th. But I'm saying watch the stock markets, okay? Watch the stock markets Friday the 13th, because that could be a very, very significant day. It could be a very, very significant day. And, that's your cash. If you save cash, after that crash, it will be worthless, dude. It will be worthless. It will be paper. It isn't backed by gold. It's just debt. That's what's got this country in the situation it's in now, is the big banks, right, creating this debt. All right? So if you sit there and say, well, I got a couple of things, but I got $2,000 in the bank. Big whoop, man. Big whoop, man. That $2,000 is going to do nothing. It's going to do nothing. Right? It is a significant day, absolutely. And when I show you the Trump clip, okay, which I will here in a few minutes, when I show you the Trump clip, I'll find the clip I'm talking about and let you see, because it's shocking. I'm serious. They came back to do like 6 episodes and talk about the end of the world. I've never been into the show before, but for some reason I ended up catching that one, and it stuck with me for a long time. It was so weird and eerie when I watched it. Like, damn. The way they filmed it, they were talking right to the camera and everything. It's just, you know how this stuff is. Sometimes I guess it can get to a person, but that was one of them times where my heart was like, pay attention. So, and now here we are, right? And then when he said that today, that the ban wouldn't start till Friday, and we've been watching these markets plunge, and they almost got back up and looked like they were going to be healthy again, and then all of a sudden, what'd they do? They released a tsunami of news saying shit just hit the fan, and it got way worse. You know, so everybody do that for me at least. You know, I've already shown you. I've shown you, man. Event 201, they were prepping for this. I've shown you, you know, when they start declaring the states of emergency, why they're doing it. And I've also shown you, which I'll show you now, right? I'll show you now these checkpoints and the National Guard, and I'll show you the docks and stuff where food is coming in. I'm going to show you that right now. And you'll see that I'm not lying to you. I'm telling you the truth. You know, and let's all, you know, and if anybody is well off or has what they need out there, consider supporting me and helping me, not even for this show, so me and my little ones can get prepped and prepared. You know, like I said, they're said here, the food pantry's already down. You know, I don't know what your life is like, but some of us, you know, regularly go there. The grocery stores are running out. So, you know, that's what I'm trying to say. I'm not trying to create panic or fear, but I'm trying to tell you now, if there's no food coming in, right? If there's none coming in, then what's in there might be all that's in there, and there might be not too much after that, right? There might be warehouses where there's, you know, a couple shipments more. I really feel like they've been prolonging it till this point. I told you mid-January. Then they release it on, you know, 3/11, which is 33, right? And then put it all off till Friday the 13th. You know, there's some significance in this, guys. And we also know what season we're in, right? Nobody's, you know, sitting around kidding themselves like we didn't see the great sign in heaven, September 23rd, 2017. You understand? So, you know, having 10 G's in the bank is not going to, you know, it's not going to keep you alive, dude. Because it's just paper when it all begins. You know, it's just paper. And so if we can help other people out, we should. You know, if you're prepped up, start helping others. If you can help others, do it locally, your neighbors, whatever. Because I'm telling you, not doing it could backfire in a major way on you also. Keep in mind that no matter if you're good or not, it's really good to get your neighbors together and stuff, because those are the people who live around you, and you guys will be able to take care of each other, look out for each other, right? Kind of watch each other's backs. And if they're starving, who do you think they're going to come to first with me? You know, and that's what I'm saying. If the United States as a whole, the people that can take care of it, and help the ones who can't. You know, that would keep people from when the food's off the shelves, from going in someone's house and trying to feed their kids and stuff like that. That would keep those type of things from happening. You know, and don't think that even if this government of ours sets up places for help, that they're going to be a benevolent place. You know, matter of fact, I feel like they have been planning these agendas for so long to lead us into situations just like this. That way we will have no other option but to turn to them for help. All right? It's to turn to them for help, you know. And in case you ain't noticed, a lot of people who supposedly come down with this or enter a lot of these places never come out, man. Never come out. And convenient political opponents, convenient whistleblowers, you know, it's so, use your brain, you know, use your brain. You don't have to be scared to be aware, you know, and I think it's absolute stupidity to sit around and pretend like these things aren't happening. You know, that's just me. It's absolute stupidity to sit around and say, no, when you're watching it, you're seeing it unfold. You know, right in front of your face.
Demonstration of
and
Wirecast.
like we were talking about yesterday. You know, there's a few other things that I've seen recently that have kind of perked my ears up also. Now, we know that this is the beginning of a series of things, right? I've heard a lot of talk of basically getting Trump out of there. Now, as you know, I'm no big Trump supporter or anything like that. Actually can't really stand the guy. But if he is the last president, and he is, you know, being compared to Cyrus, the son of perdition, and all of these things, did I also not tell you that right around this time, next couple months or so, would be the time to watch to see if there was some type of attempt on him? You know, so it's really weird that they're starting to put those kind of things out there again also. Not to mention that this famine, pestilence, plague, and all of that, it begets violence, right? Peace is taken from the earth as a result, and a lot of people die according to Revelation. So that's another thing. So sow some good seeds now, help some people now. That way you got some good karma, and you got God on your side. And not just that, this is all followed by eventually a major asteroid collision is one of the next calamities to happen. And what's really weird is we've got a huge ass asteroid, and I was talking about it yesterday, and the way that they described it is what really got my attention. In the Bible, it's described as a mountain set ablaze, and it lands in the ocean, kills a third of men, a third of the marine life, right? And it's a big event. Well, they are warning us. They started warning us. I think February 21st was the first time I seen anything about it. So they gave us a 40-day warning, which is just like in the Bible. They give a 40-day warning, which I thought was weird. So is it a coincidence? Maybe, right? It could be nothing. And let me pull it up just so I can show you what I'm talking about for those of you that don't know. But we're in that season, so, you know, we are. And let's see if I can find it right here. Right here. Yeah. This mountain set ablaze. Look, a mountain-sized asteroid will appear as a slow-moving star next month. So this mountain set ablaze, right? It'll look like a slow-moving star. Does that not seem like a mountain set ablaze? You know, it looks like a mountain, and a slow-moving star is something burning through the sky. You know, and this thing's extremely close too, right? Extremely close. And it's potentially hazardous. And it'll pass by here April 29th, guys, and it's 2.5 miles across. And what's strange about that also is that according to Gil Broussard in his research of the PX system, it's March, April of 2021 where that event will actually take place. Well, when it happened the last time, the Asian guest star, they seen it first about 13 months before it actually appeared, and it appeared to them like a bright star shooting across the sky, right? So do I think this is going to come crashing into us? No, I actually don't. But I think it's very significant and a sign of how close we are to all of these things actually unfolding. And, you know, even when we looked at the gematria around the name COVID-19 and coronavirus, what did we see? Like Trump, blood moon. And if you guys remember, I did that show in 2019, January, on the 70th anniversary of Israel and the super blood moon, and that the 4 horsemen of the apocalypse that was a signaling their release, and that was immediately followed by epic flooding, right, which destroyed large amounts of crops, right? And then we seen Ebola bubble up, measles bubble up, and you know, now it's kind of all led us to where we are now with You know, things like Arctic ice turning blood red. We just seen water in the Strait of Hormuz turn blood red. And we have locust plagues literally devouring all of the food in East Africa and China, India. These things are, you know, really starting to rev up, man. And like I said, I'm not one to be afraid. I'm not one to sit and ring the alarm. And, you know, no knock against other YouTubers. I don't even want to say none of their names because I don't want to be mean. But there's a couple of, you know, there's one guy in particular. And I love watching his channel, man. He's good. But he comes on there, at least I feel like once every other month, and says, "This is it, America. This is it." You know, and pushes a lot of prepping stuff. I don't want to be that dude. And I'm not trying to be that dude. That's why I'm saying, you know, get your shit together. Yeah, Naughty Beaver predicts the same time. He sure does. And I've been doing this just as long, if not longer, than Naughty Beaver in some way, shape, or form. I haven't been on YouTube as long as Naughty Beaver. But I did podcasting for about 2 years before I came here. And what got me to listen to Naughty Beaver is we were both talking about the great sign in heaven, to be honest. And there's a Nostradamus prophecy that talks about Mercury and the sun hiding Venus, and this being the revealing, basically, of a Messiah or Messiah-like figure. I can't think of the actual name or the word for word, the prophecy. But March 6, 2021, which is 1,260 days later, which is precisely the amount of days. My son's so cute. He looks like a little devil, don't he? Looks like a little devil, don't he? In his little... yeah, he is cute. I love him to death. And that's why I want to make sure that I'm prepped up. So I have 3 of them. 3 beautiful boys. I'm very, very blessed. God bless me 3 times. 3 times. Beautiful kids. So, and that's, you know, so, and I'm telling, I know you guys are blessed too. You know, you guys are blessed too. Maybe not with the same exact blessing as me, but you have people you love. You have people you love. Most of us all love somebody, something. Could be a dog, man. It doesn't matter, right? But you don't want that dog to starve. You don't want your wife to suffer. You don't want those things to happen. I'm trying to tell you right now, you don't want those things to happen. You know, and this isn't to throw fear into you. This is just being smart. You know, getting ahead of something that you can see that is obviously unfolding. Obviously. Sure, I'm showing you a lot of coincidences that are happening. These may or may not add up to anything, right? That's the truth. They may or they may not add up to anything. I think it's strange. Yeah. They may or may not add up to anything. But I can show you what is adding up to something right now. Right now. You guys remember this old dude talking about the military checkpoints? I'll play like 30 seconds of this and then show you what he's talking about. Let me make sure you got audio. I apologize.
This is a demonstration of Wirecast.
Promise some evidence. Here you go.
Hi, ladies and gentlemen. This is an impromptu, extemporaneous upload this morning. Today is March 5th. It's Thursday, 2020. I'm Roy Potter. And I got a call last night, a very frantic call from a friend of mine there who lives in Las Vegas. His name's Brand Thornton. Most of you may know him. And he was very frantic, very upset, really upset.
If you guys have ever seen somebody who looks like they're lying or full of shit, this dude doesn't look like that to me. He doesn't strike me. And he's obviously has military experience from the words he's using and stuff. I apologize for interrupting, but I just want to point that out, man.
Heard and saw the video that he had sent to me. I got pretty concerned, not direly concerned, but I thought after looking at all the possibilities here this morning that I would go ahead and make this upload. This is not a DUI checkpoint. Okay, that's not what this is. He sent me a video of somebody who saw the military setting up, I don't know if it's a National Guard unit, regular Army, I don't think it's Air Force. Pretty sure it's probably a National Guard unit or possibly a regular Army unit. It's north of Las Vegas on I-15, just off I-15 at the junction of I-215 and Range Road, which is northeast Las Vegas area on I-15.
All right, there you go. Now, check this out.
People can see this. We got a friggin' tank. They got all kinds of bullshit. They got fucking radars out here. What the fuck's going on out here?
Sir, you're not allowed to be on this installation.
I'm not on your fucking installation, bitch.
I'm gonna
go get them.
Whoa, I should have watched this a little bit more with sound or something before I played it. Wow, man. Whoa. Sorry for the language. I didn't have the sound on when I watched it. I mean, but if you can't take a little bit of cussing, you're damn sure not going to be able to take the things that are going on. So,
this is a
literally.
demonstration of Wirecast.
Old dude telling us all about it, describing all of it, right? Here it is. Here it is.
See this? We got a friggin' tank. They got all kinds of bullshit. They got fucking radars out here. What the fuck's going on out here?
Sir, you're not allowed to be on this installation.
I'm not on your fucking installation, bitch.
I'm gonna
go get them.
The bitch was a little much, wasn't it?
Look at this shit. This is all, look at that. I don't know if you can see it. It's bad. 215 Range Road, just outside of Las Vegas, Nevada. Can't turn your phone while live. Anyhow, they got fucking tanks out here. They got everything out here. They got all kinds of radar bullshits going on. There's supposed to be somebody fucking coming out here to talk to me. They told me to leave. Fuck them. I don't give a rat's ass. Where are they? Supposed to come and talk to me.
Now, do you see what I'm saying, man?
This
you know,
is a demonstration of Wirecast.
Do you see why I'm like, you know, I'm not trying to pump fear in your head, man. But this shit ain't normal. You know, here we go.
Sir. What?
Training exercise, sir. How can I help you?
Okay, has this got anything to do with the coronavirus?
No, sir.
You sure about that?
Yes, sir.
It's a training exercise. How come you're so close to I-15?
It's just where our facility is located, sir.
This is a
I think
demonstration
it's bullshit.
of Wirecast.
I think you guys are up to something and you don't even know what it is.
I'm just a sergeant, sir. I don't know.
I know, you don't know. You're too young to know anything that's going on. You guys.
Yeah, that guy is full of shit. You can tell, man. Anybody who's ever studied, you know, like what the police and intelligence agencies use to determine whether you're lying, because our left brain uses our logic, our memory, right? And our right side is our creative side of the brain, and our eyes will point to the opposite side, you know, because our brain is like cross-wired basically. So when your eyes are looking down to the left, that means you're coming from the right side, which is the creative side of your brain, because you're formulating a lie, you're creating a story, right? So wow, you know, this guy's calling them out on their stuff, man. He didn't have to call the girl a bitch though. I mean, that was a little bit much. You know, she's not responsible for this. Matter of fact, in my opinion, and it's just my opinion, I have no problem with anyone in the military. I think that I remember being a young kid signing up for the Navy. Like, I think that these these people, they're deceived by that great lie we're all deceived by, man, that America's great and we're free and these wonderful liberties. And, you know, despite all its flaws even, dude, I don't hate America. You know, I don't. I wouldn't want to be anywhere else in the world, to be honest. You know, I don't. I don't hate the people here. I just can't stand the damn government that sold us out. You know, and you can see why these mystery schools and occultists look at us and call us the profane. Or these Zionists, you know, call us going dogs. You can see why. We've proven them right. You know, and it's like a big kick in the nuts, if you ask me. It really is. To see that we were given a chance for true liberty here. You may not agree with me, but, you know, when the Founding Fathers created this country, they gave it was ours to lose. It was ours to lose. And we gave it away. We gave it away in every way, shape, and form. I mean, they literally created a damn near perfect Constitution, Bill of Rights, these type of things to keep outside forces from coming in and doing what they've done. And I mean, it took almost 100 years for it to really go sideways, you know, with the creation of Washington, D.C. and America becoming a corporation, which the president is the CEO of. You know, so it took a while. But then by, you know, 1913 and 1933 and, you know, the Federal Reserve and then gold not being behind the dollar anymore, it was all over. It was all done but the crying by that point. And then you guys know the final stage had began, 9/11, right? That's when it was the implementation of the surveillance and the police state that we know now. So when you see, you know, something as significant as 3/11, the 33, and Friday the 13th, don't tell me that this shit don't mean anything. You know, don't tell me it don't, because I've watched it mean something. I just named 2 dates, right? 1913, right? There's your 13, right? And then 1933, there's your 33, right? 2 of the most significant times in American history, you know, where we lost our shit. Or 9/11 and this COVID-19, right? So there's a, you know, they're significant in these things, right? They understand. I've talked about, you know, Tiamat or Cthulhu or Kundalini, right? The serpent energy that these occultists use, and they use, you know, the moon and all of that too, the planets, numbers, geometric shapes, right? Because it's the code of this matrix or whatever that we find ourselves in, and they use it against us. So these things are very significant. And you think, well, what does that have to do with government, John? Laws, man. Come on now. You know, they can't predict when, yeah, they can. Yeah, they can. Especially if they release the damn thing. They know exactly when. So, you know, don't tell me no. You know, go look for yourself before you start calling me crazy and all that. Before you start calling me a conspiracy theorist, do a little bit of homework, bud. That's all I'm saying. That's all I'm saying. I'm not trying to scare you or beat you over the head with this stuff. I just want you to hopefully prepare a little bit, man, and to be aware a little bit. I've been doing this a while, and I gotta say, I've seen a lot of scares over the years. You know, some World War III close calls. You know, some really significant laws passed that changed things incredibly. Elections, I've seen some really significant things, but I haven't really felt the heat like I have off this one. Because I'm watching, you know, all these things in unison, right? there is, and it's what they don't say is usually the worst parts. What they don't tell you. You know, but what good citizens like this guy, except he needs to respect women, you know, do by showing these videos, by going out and checking these things out, not by taking the news' word for it, you know, and, you know, they're telling you the food's all right and all of this, but check this out. Check this out, guys. I don't know. Maybe.
Look, there's no boats, there's no nothing. There's just this stack of cans. That's it. Now, I'm going to take y'all around to another part of the ports to show y'all how empty this is. Because this is the stuff that we buy, the stuff that we shop for in stores. And if there's no cans here, there's no imports. Look at that. You can see all the way over to trucks going on the other side, which lets you know that this is deserted. I should have took a video of the other port that I just came from, which was the China port called Yangming. There's no, this is just as empty as this one. There's nothing going on. And there's no trucks here. And this place is usually having hundreds of trucks. Look, there's one. That's an empty can that they're bringing. So mostly it's like empty cans are coming in and there's nothing going out. So there's, I mean, y'all better buy whatever y'all gonna buy because there's no telling how long this is gonna go on. And apparently this is supposed to be because of the coronavirus. Now, this is a real view. This is the real deal of what's going on. This is not something that's seen on the news. This is me out here on the field doing this, letting y'all know what's going on. That truck, it probably got a load, but look at this. This place is empty. These things are tall as buildings and stacked a lot, but it's not happening today. So I'm walking around to show y'all what's going on. Look at this. This is open. This is never open. I can never walk through here like this. Look at that. That's just a few. It's usually stacked like real tall and a lot. Look at this. All this empty space. This is no products coming in. So if y'all want to know for sure what's happening with the coronavirus, this is what's happening.
There you go, man. I'm not bullshitting
It's completely
you. You know, I'm not bullshitting you.
This is a demonstration of Wirecast.
This is what I'm trying to say. You know, when you go to like a super center like Walmart, it's understandable they can talk about supply and demand. The whole world is in supply and demand for shit like hand sanitizer, bleach, right, disinfectant wipes, those type of things, right? That's explainable. It's understandable. But when I started seeing things like beans and stuff disappearing,
This is a demonstration of
you know, those are things that are replaced on a regular. I was a manager at a grocery store for a few years when I was younger. So I know how the ordering and all of that works. And, you know, that means there's no trucks coming in if nothing's being replaced. You know, and then you look at these, like I said, a couple weeks ago, this wasn't the case. I talked to my friend in Louisiana who works at one of these places, and he said, you know, there wasn't a lot, but things were coming in. And then just recently I talked to somebody else who, you know, does this as well, and they said nothing. And I started scouring for the footage, and sure enough, you know, there is nothing coming in. So, like I said, man, when things take ugly turns like this, I'm trying to tell you, your money is fucking worthless, dude. Your money is worthless. So don't think if you save 10 grand back, anybody's going to care. You know, it's as good, it's kindling at that point.
This is a demonstration
you know,
of Wirecast.
it's kindling at that point. All the money in the world can't save you in this type of situation. Right? It's on you having enough wherewithal to make sure you have adequate medical supplies. First aid. Save your damn antibiotics, your Tylenols, all of that, man. Gather it up. Get it together. Make sure, fill up water jugs and milk jugs, things like that, man. And you can boil it. You can filter it. Go buy tablets to purification tablets. You can get cheap water filters. Me and Joe did a show on here, prepping for shit hit the fan like a week ago. And it was really good with a lot of ideas on what you can do in these situations of buying beans, buying rice, right? Making sure you have oils, lard to make these kind of things stretch.
This is a demonstration of Wirecast.
That's a lot of the places that sell MREs and all of that, they're sold all the way out, right? So now it's going to have to be, using your know-how, and I really hope that people will help other people out. That's what I'm really worried about. That not just like me and my little ones, but I'm worried about everyone that's in that situation, because I know how many people in America live hand to mouth, dude, day to day. Day to day, right? They struggle to pay their bills. They struggle to get groceries, and then when they're shutting down the places that kind of alleviate that for them, like food pantries, right? Like those type of places, man, that puts them in a really tough spot just to get by, let alone prepare, How can they prepare if they can't even get by each day? And when it's gone, it's gone. Nobody's going to come off of it because they're going to want their family to survive. So I truly hope, people help their neighbors. Help those in need, man. You cannot take this money with you. You can't, dude. You can't. And I know a lot of people that think that, as if anything in the bank's going to even be there when the country goes under. Yeah, right. You guys have heard of the buyouts, right? They're doing buy-ins now, which means they take all of the money from the people in the banks, the families in the banks when banks go under. You better understand how it's all been restructured. Right under your nose, seriously. And this isn't to scare you. This is hopefully a sobering video. You got the National Guard rolling in everywhere. I just showed you them set up in Nevada. Chemical, biological, nuclear, right here, Florida. And this video should be viral. It should be viral. How many people do you think have seen what we've looked at? Know that they've been practicing for a pandemic and then creating orders for civil deployment by the National fucking Guard, who you see in the videos, right? Last October. And you see here with the graders and the backhoes and the dozers, the digging equipment, right? The digging equipment. You better get hip to what they're digging for, man. What do you think they're digging for? Because I can show you what they're doing in other countries when they're digging. That's why they're digging. In Iran, China, that's where they're digging. Japan, that's why they're digging. You feel me? You feel me? So, sow some good seeds right now. Sow some good seeds. Do some goodwill. Get other people hip to this. You know what I mean? Get other people hip to this. The only thing you can do, man, is ring the alarm, man. And I'm not saying it to alarm them. I'm saying to make them aware. Is all this a damn coincidence? We got these biblical events, right? 4 horsemen, it's famine, pestilence, plague, right? Peace taken from the earth, then a mountain set ablaze, right? All of these things, man, followed by World War and then a great star, and then we're seeing all these things. We've been talking about all these things for a while now. We watched the Great American Eclipse, cover America in darkness at midday. Judgment in the Bible over a nation every time that happens. And USA is Babylon. The next time it happens, 7 years exactly. Right? Not a coincidence, man. The great sign in heaven, never seen before, never be seen again. This perfect alignment with this son that's being born just so happens to be in the womb of Virgo for 9 months. Come on, man. No coincidence. Or, 3.5 years later, to the date, Comet Inky will be shown in the sky, revealed by the fire of Mercury, just like the Nostradamus prophecy. Or how Nostradamus told us that the conflict with Iran would start this series of events, right? The Arab prince, Sun, Mars, Venus, and Leo, right? Persia, very nearly 1 million men, right? And what did we see? The Arab prince, Saudi Arabia, the oil tankers attacked by a drone, right? Modern day Persia is Iran, and their armies of 850,000 people.
This is a demonstration of Wirecast.
And what did it say about Trump? That he was the false trumpet, concealing the madness. Concealing the madness. And what is he doing? He's saying, be cool. It's all good. But we also know that this son of perdition, will take a fatal wound to the head and live 42 months in. 42 months in.
This is a demonstration of Wirecast.
So, by my calculations, that'd put us around April or May, right? Around April or May, maybe March, but March to May is when I say would be like that potential sweet spot for if that's going to happen, it would happen. And now we're hearing people like Alex Jones talk about they're about to try to take him out, which let's not even pretend like he's not a shill, right? He's got Illuminati cards too, right? Agent in place and shit. I mean, the guy was a damn comedian that pretended to die so he could come, kill the real Alex Jones and do this. And then they're literally throwing it right in your face. Mountain-sized asteroid will appear next month, move like a slow-moving star. A mountain set ablaze, right? And it just so happens to be exactly 1 year or 13 months, basically, a little less. Just like when the Asian guest star was seen, like a blazing star in the sky, before the PX event happened then. So these are a lot of very, very significant things, in my opinion. Now, I do want, before we jump into some of these other things that are happening across the globe, I want to show you, man. It's not just here. I want to show you a quick clip from Trump's announcement that just took place tonight.
My fellow Americans, tonight I want to speak with you about our nation's unprecedented response to the coronavirus outbreak that started in China and is now spreading throughout the world. Today, the World Health Organization officially announced that this is a global pandemic. We have been in frequent contact with our allies, and we are marshaling the full power of the federal government and the private sector to protect the American people. This is the most aggressive and comprehensive effort to confront a foreign virus in modern history. I am confident that by counting and continuing to take these tough measures, we will significantly reduce the threat to our citizens, and we will ultimately and expeditiously defeat this virus. From the beginning of time, nations and people have faced unforeseen challenges, including large-scale and very dangerous health threats. This is the way it always
I apologize.
was, always will be.
Looks like I got an echo. Sorry about
how
that.
You respond, and we are responding with great speed and professionalism. Our team is the best anywhere in the world. At the very start of the outbreak, we instituted sweeping travel restrictions on China and put in place the first federally mandated quarantine in over 50 years. We declared a public health emergency and issued the highest level of travel warning on other countries as the virus spread its horrible infection. And taking early, intense action, we have seen dramatically fewer cases of the virus in the United States than are now present in Europe. The European Union failed to take the same precautions and restrict travel from China and other hotspots. As a result, a large number of new clusters in the United States were seeded by travelers from Europe. After consulting with our top government health professionals, I have decided to take several strong but necessary actions to protect the health and well-being of all Americans. To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight. These restrictions will be adjusted subject to conditions on the ground. There will be exemptions for Americans who have undergone appropriate screenings, and these prohibitions will not only apply to the tremendous amount of trade and cargo, but various other things as we get approval. Anything coming from Europe to the United States is what we are discussing. These restrictions will also not apply to the United Kingdom. At the same time, we are monitoring the situation in China and South Korea, and as their situation improves, we will reevaluate the restrictions and warnings that are currently in place for a possible early opening. Earlier this week, I met with the leaders of health insurance industry who have agreed to waive all co-payments for coronavirus treatments, extend insurance coverage to these treatments, and to prevent surprise medical billing. We are cutting massive amounts of red tape to make antiviral therapies available in record time. These treatments will significantly reduce the impact and reach of the virus. Additionally, last week I signed into law an $8.3 billion funding bill to help CDC and other government agencies fight the virus and support vaccines, treatments, and distribution of medical supplies. Testing capabilities are expanding rapidly day by day. We are moving very quickly. The vast majority of Americans, the risk is very, very low. Young and healthy people can expect to recover fully and quickly if they should get the virus. The highest risk is for elderly population with underlying health conditions. The elderly population must be very, very careful. In particular, we are strongly advising that nursing homes for the elderly suspend all medically unnecessary visits. In general, older Americans should also avoid non-essential travel in crowded areas. My administration is coordinating directly with communities with largest outbreaks, and we have issued guidance on school closures, social distancing, and reducing large gatherings. Smart action today will prevent the spread of the virus tomorrow.
There you go. I mean, that's about the gist of that, right? So let me show you some things, though. I got this today from a subscriber, and it's a letter here. It says, this afternoon, there will be an email sent from CBS letting everyone know the measures we're taking from the coronavirus outbreak starting tomorrow, Thursday, March 12th. Everyone on our team will be working from home until further notice. You will work your normal shift with your start and stop times, lunch and breaks. If you have not worked at home in the past, please make sure you try and log in before your shift starts. Anyone who does not have internet or is unable to work from home will be expected to report to the office. If you're going to be out, you'll need to call out time. And this is basically talking about having your shit ordered, your prescriptions ordered. Right? They'll be doing it. These items will be sent out each week instead of daily. Attach items that will be mailed, including cover sheet. Right? So there's one. Right? And then I got this from a subscriber also. This is in Utah. Over the weekend, we learned, as did many of you, the patient with COVID-19 was securely transported to Intermountain Medical Center here in Utah. And this is talking about how a student was quarantined. 17 others were tested. Salt Lake City. This is the school district saying that. And I got an update from them today. Let me pull this up here. I'm not going to show you because I don't want to give away their identity. But I'll tell you what they said. Okay.
This is a demonstration
from the school,
of Wirecast.
2 more people with the virus here in Salt Lake, and now have a 3rd case up in Park City. Yes, 2 more people in Salt Lake, and then a 3rd case in Park City, Utah. So, these are some things I haven't seen in the news, though. Right? Mississippi health officials report their first positive case of coronavirus. I know that it was saying there's 12 states that are in a state of emergency, but there's 13 now because, where is it at here? Where do I got it here? Yeah. Arizona is now state number 13. Arizona governor declares state of emergency on coronavirus with 9 cases so far. The governor, Doug Ducey or whatever, declared a state of emergency on Wednesday over the novel coronavirus, saying he was not taking any chances as the state expects more cases. So far in Arizona, 9 people have tested positive for the virus known as COVID-19. The latest is a man in his 90s. And he says, this is an important proactive action. To date, we've not had a community spread at a nursing home or elder care facility, but we could. And if that did happen, we wanted the Arizona Department of Health, DHS, to be equipped to act with urgency. And every time I see one of these, state of emergencies, this is where my mind goes, y'all. Right? This is where my mind goes, right? For the support of civil authorities, right? And the only way that it's enacted is by the president calling a national emergency, right? Or the governors declaring state of emergency. And it's literally in response to a major disaster or emergency. And I can show you literally where it tells you that the governors have to do that. Doesn't mean give requests for federal assistance will come with little warning within the United States. And yes, that the Marine Corps Reserve or to active duty for a continuous period respond to governor's request, right? By responding to a declaration of major disaster or emergency, the governor's request. And that's exactly what we're seeing, right? Exactly what we're seeing everywhere. You can see here, Iran vice president and 2 cabinet members test positive as the death toll hits 354. Authorities announced that there are some 9,000 confirmed cases across the country. Number of infections climbs across the Middle East with 262 in Qatar and 189 in Bahrain. I think I got something else that went on here too as well. Let me see if it's right here. Yeah. Dozens of Iranians die from methanol poisoning in an attempt to fight coronavirus. I'll show you this right here also. and spraying this shit everywhere, and they're killing people with it. This is literally poison, and people are dying from the damn methanol instead of the coronavirus. Is that not crazy, man? You know, and you see them spraying this shit in China too.
This is a demonstration of Wirecast.
Look at that. I mean, were the people like, were they sucking this shit in? How did, how do all these people die of it? Or, at least 44 people have died of methanol poisoning in Iran. 44 people, man. They've killed 44 people with trying to stop it. And how many have died from the actual virus here? Let's see that. Death toll hits 354. Okay. Well, still, 354 people have died from the virus, and they've killed another 44 with their methanol, man. So 400 people have actually died as a result of this shit. And you can see the world map here. The whole damn thing's red now. Despite alcohol being banned in most of the Islamic Republic, it's responsible for hundreds of patients being hospitalized because of fake rumors that it would save drinkers from the virus that killed 291 and infected more than 8,000, the state news agency reported. So they're literally telling people if you get drunk, you won't get sick. Shit. I know a lot of people that are good. And like I said, this is more of the convenient, political deaths. Dude, we have seen nothing but a bunch of this stuff like that. Who was top of the health administrator, I think is what, I can't think of the title now. The health administrator, some crap like that for Iran. He got sick, man. There was another Iranian official that died, and now you see the vice president and 2 cabinet members test positive. Very strange, man. South Korea's trace, test, and treat approach, they seem to be handling this thing better than anyone else across the world. They're literally testing everyone. They've got these like drive-through centers where you can go get tested and shit. It's very crazy. Negative pressure room. One of nearly 20,000 people being tested every day for coronavirus in South Korea. Her samples quickly shipped off to a nearby laboratory where the staff are working 24 hours a day to process the results. Look at that, man. They learned the lessons from MERS. South Korea must be doing it right, doing something right, I guess.
This is a demonstration
Coronavirus,
of
Japan
Wirecast.
scales back triple disaster memorials. The 9th anniversary of earthquake, tsunami, and nuclear meltdown came as Japan reported biggest one-day rise in infections. Look at that, guys. So they literally, have the earthquake. I mean, that's crazy. All these on the same day. And you can't tell me there's not anything significant about, the 311, the 33. The coronavirus outbreak has forced Japan to scale down events marking 9 years since a powerful earthquake and tsunami killed more than 18,000 people along its northeast coast. An annual public service in Tokyo to remember the victims of the March 2011 disaster was among a growing number of events called off. One day after the Prime Minister Shinzo Abe said sports, cultural, and other large gatherings must be postponed for another 10 days in an attempt to contain the spread. The main memorial service at the capital's National Theater is usually attended by members of the imperial family, politicians, and the relatives of people who died. The anniversary of the earthquake, tsunami, and nuclear meltdown in Fukushima came as Japan reported 59 new cases of COVID-19, its biggest one-day rise since the start of the outbreak. The total infections in Japan have risen to 1,278, including 696 passengers and crew from the Diamond Princess cruise ship, which was quarantined in the port of Yokohama last month, and 14 people repatriated from China at the start of the outbreak. Yeah, their death toll as of Wednesday stood at 19 from the virus. Italy shuts down all shops and restaurants as coronavirus cases rise.
I numeri ci dicono che stiamo avendo una crescita importante dei contagi, delle persone ricoverate in terapia intensiva e subintensiva e anche, ahimè, delle persone decedute. La decisione giusta oggi è di restare a casa. Il futuro nostro dell'Italia è nelle nostre mani e queste mani devono essere mani responsabili, oggi più che mai. Ognuno deve fare la propria parte. Ed è per questo quindi che da oggi varranno su tutto il territorio della penisola queste misure che noi abbiamo già predisposto per la parte settentrionale, come sapete, Lombardia più provincia, in più province, giusto qualche giorno.
So they locked down 60 million people, y'all. I mean, literally, was it just yesterday? I was saying 12 or 16 million people, 60 million people. Italy all but put a halt to normal life, paring the economy down to just essential services in a desperate bid to stem the advance of the deadly coronavirus. Prime Minister Giuseppe Conte ordered all shops in the country to close except for grocery stores and pharmacies until March 25th. Public transportation as well as financial and postal services will continue, but the country's normally vibrant restaurants, cafes, and bars will be shut. So factories can continue operating, but only with precautions, the premier said. So, you know, things hitting hard everywhere, man. All the countries, and you can see right here, this is about a horseshit site, but they're supposed to have the right numbers. WooFlu.live. Oh, they've actually changed it to Covid-19 info.live. But you can see here, guys, the numbers confirmed